We are going to study about the aphasia. So here the aphasia, when there is a disturbance in the central speech apparatus. So aphasia is defined as a defect in the production or comprehension of the written or spoken language, okay, on acquired lesion in the brain. Okay, so when there is a disturbance in the central speech apparatus in the brain, we know that there is a central speech apparatus is there, that is connecting these Broca's fascia, connecting the Broca's area and the vernix area, etc. And aphasia means it is a defect in this production, okay, defect in production, and also not only in the production and also in the comprehension of that written or the spoken language, okay, that is aphasia. And dysarthria means problem with the peripheral speech apparatus. It is not the problem in the central speech, it is in the peripheral speech apparatus that is the problem. So here there will be a difficulty in the articulation of the speech, okay. Here there is no production, here difficulty in the articulation. Speech is produced but there is a difficulty in articulation of that speech, okay. So, and language representation in the dominant hemisphere, okay, and the language representation is mainly in the dominant hemisphere, okay, that is mainly a person that is in the left hemisphere, okay. So that's it. So the areas for the speech and also the praxis, that is located in the dominant hemisphere, okay. Next is perisylvian language network, okay, that is the 7 areas are interconnected in the perisylvian language network. Next we are going to study about the classification of the aphasia, that is the Boston classification of aphasia, Broca's aphasia, vernix aphasia, global aphasia, anomic aphasia, conduction aphasia, transcortical sensory aphasia, then transcortical motor, transcortical mixed, and also a last isolation like aphasia. So the main the first one we should know about the bedside language examination. Bedside language examination, that is we should look for the spontaneous speech. Spontaneous speech means you should ask for like informed interview, okay, informal interview. Then structural task, we should ask the patient to do some structured task. Then automatic sequence, okay. So tell me the complaints. So ask the patient to tell me the complaints, what are the complaints, but you should say like not say in one word, briefly you should explain your complaints also, okay. That is the like informed interview in like total. Then structured task, that is you should ask the patient that how will you go to home, like from the hospital to the home, how will you go, like say in a structured manner, like structured task, okay. So that's we are looking in the spontaneous speech. Next is naming. You should give a pen and just tell what is it, name the pen like that, okay, that is naming. And third one is auditory comprehension. Auditory comprehension means first you should ask for yes or no questions, okay. So first you should ask for yes or no questions, if the patient is saying yes or no. And next show where is the window in the room, like ask the patient where is the window in this room, okay. And next so first is yes or no question, then ask the patient to show the window. Next ask the patient to touch, okay, touch the window, like 2 tasks 3 tasks like that we should do, like we should say something and like and she should do that, like that task we should give, that is auditory comprehension. So here the patient is hearing and comprehending it, that is auditory comprehension. Next is repetition, that is repeat the word. So you should repeat a word, you should say a word and ask the patient to repeat that word. And next you should say some sentence and ask the patient to repeat that sentence, particular sentence, okay. So if it is affected, that will be where the lesion will be in the perisylvian language network, okay. Repetition is mainly affected when there is a lesion in this perisylvian language network, that is which is consisting of the 7 areas, okay, interconnected areas. Next is reading. Then you should look for that reading aloud and reading comprehension. Then in writing, look for spontaneous sentences and you should say something and write spontaneously. Then writing, then copying like that, okay. So first we are going to study about the Broca's aphasia.